This is a KX News special report.
Good afternoon, North Dakota. Thanks for joining us on our delayed launch of today's press briefing. You'll still tune in. As you probably heard, we moved this back for the SpaceX Falcon launch, which was then canceled due to weather. They're going to reschedule apparently for Saturday. But one fun fact, if we don't, before that the ship heads up into space, of course, this is the first time astronauts are riding on a commercially developed U.S.-made rocket. It's one that's not owned or operated by NASA. First launching from U.S. soil since the final space shuttle mission in 2011. And another fun fact, on one of the astronauts on today's launch, Doug Hurley, is married to Karen Nyberg. She's a native of nearby Vining, Minnesota, and she earned her degree in mechanical engineering from University of North Dakota and then became an astronaut where she met her husband. She spent, Karen did, Nyberg, 166 days aboard the International Space Station back in 2013. So a nice North Dakota connection to what Saturday will now Saturday's historic launch. And of course, we wish all of them well on that journey. Jumping into the numbers for today, COVID testing numbers, the North Dakota Department of Health confirmed 17 additional cases out of 1,048 total tests conducted. This is our lowest single day reported increase since April 21st, which is good news. Testing numbers, about half of what we'd like to see them at. This is a little bit of the carryover, as we talked yesterday quite a bit about testing. 24 to 48 hours after it gets to the lab is the goal for us to move things through our labs. But again, this reflects that, well, there was some good test collection happening on Saturday of the Memorial Day weekend. Things definitely slowed down on Sunday and Monday. They picked up again yesterday. We expect that for the rest of the week, with all of the outbound testing we have, that we'll see those numbers get back up more in the target range that we want to be. But even with this 1,000 tests, very piece of good news here is 1.6% of those were positive, which is one of our lowest rates also in some time. This brings us to 67,340 unique North Dakotans that have been tested, and that's closing in on 9% of the population, which is among the highest percentage of any of the states in this country. So again, great job to North Dakota. And of course, why we're doing that testing, because the testing is what allows us to then identify and then contain the spread of this contagious virus, and in doing so helps us reopen our economy more quickly. So again, testing is the path back to having the life as we knew it. On serial testing, we've talked about before, which is this idea that some people need to get tested multiple times, and that would be if you're someone who's working in healthcare, for example, and you're being regularly exposed to people that may be COVID positive. A case here would be long-term people that work in long-term care and healthcare or represent a significant portion of these, and other people that may be working in congregate environments. Today's, of that, 486 were people that were being tested for the first time, and over half, 562, were people who had been tested at least once prior. And so that's that slide. The next one we want to talk about is in terms of net case breakdown. Again, when we've got more people recovering than we have new cases, that drops our active confirmed cases, which is one of the numbers that we look at when we're trying to manage this pandemic and work on more reopening. We look at hospital capacity, and there are only 40 individuals that are currently hospitalized, and that's again about 2% of our total hospital capacity, which is a good thing. And we've now seen over 1,762 individuals recover, but sadly now 56 deaths reported, including 2 that reported to deaths today of women that died with COVID. One was in her 90s, one was in her 70s, both were from Cass County, and both had underlying health conditions. And as always, our thoughts and prayers go out to their families and their loved ones. A little bit more on the hospitalization capacity. I know that people are feeling like that this pandemic's completely in the rearview mirror, and nothing to worry about. Summer's here. I just want to turn our attention down I-94 to the Twin Cities. I've mentioned this before, that this is one of the significant hotspot outbreak areas in the country right now, and confirmed through our work with our Minnesota partners next door that currently, or as of I guess the 25th of May, so a couple days ago, 87% of the ICU beds in the Twin Cities were occupied. Not all those with COVID, but they were occupied, and they have over 600 ICU beds. So just in Ramsey and Hennepin County, the two major counties that are in the metro area down there, 87% utilization of ICU. In North Dakota, of the 40 people that are hospitalized, only 13 ICU beds are being used. And so while we're doing well here, again, we need to think about our neighbor to the east and realize, again, that it's part of the reason we're in this great shape is the fantastic work of people in North Dakota. As I've said many times, it's not what government says, it's what people do, and people have exercised not only individual responsibility, they've exercised their collective consciousness and been thoughtful about taking actions that protect those that are most vulnerable, to make sure that we've got the highest level of care available, and to make sure that we can keep this disease, which is deadly for those with underlying health conditions and with age, those two factors, to help keep that out of our places where we want to keep it out of, like long-term care. And again, even from a death count in North Dakota, we're substantially below, even on a per capita basis, than some other states, including our neighbor to the east. So again, great job, North Dakotans. Next topic, Red River Valley Task Force. Again, today, when we had our low number, these 17 cases, 16 of those cases were in Cass County, and one was in, I believe, in Grand Forks County. So I want to say this is also a day when we had a lower count, so we don't want to be rushing to celebration too quickly, but you'd have to go way back to the beginning of this, when there was a day when we only had positive cases showing up in 2 counties, and that means we had no positive cases in any counties west of those counties touching Minnesota. So that's a very positive news, but also a little bit too light on the testing. So we'll save for conclusions for tomorrow, but again, that 1.6% rate for the state, very good. But when we take a look at what we're doing in Cass County, the positive test rate there, 9.6%, almost 10%, versus 3.6% for the state of North Dakota cumulative. And again, that number is dropping. It dropped with the test results we had today. Even for Cass County, but again, this is a number that's higher than what we would want it to be. We'd want to see that positive test rate continue to drop in Cass County. The majority of the active cases in the state, 488 out of 621, are in Cass County, and 45 of the 56 deaths have occurred in Cass County, and many of those have related to either long-term care or people that were in the hospital. The task force, if I can go back a slide on here, they're again working collaboratively across Cass and Clay County. At the county and the city level, we've got great collaboration from the mayors and the county leaders and the medical providers and all of the folks that are working in public health in Cass and Clay County, so that part's been great. To increase public understanding, they've created a website, fargocasspublichealth.com/taskforce. That just went up recently. As part of these efforts, they held a virtual public meeting today to provide an overview of the purpose of the task force, information on the local testing matrix, and various operational updates from task force members. A recording of the meeting can be viewed on the City of Fargo's Facebook page, and Additionally, the task force has solicited questions, comments from the public over social media channels of the Fargo Cass Public Health and its task force city and county partners. And so again, people wanting across the state or in Cass County wanting more information, fargocaspublichealth.com/task force or the City of Fargo Facebook page, and you can tune in and learn more about the great work that team is doing in Fargo, Cass County, and across the border in Clay County. Next topic relates to North Dakota Department of Health. And as you know, we've expanded a number of things in the Department of Health a lot in the last 10 weeks. Testing is one that's been at the forefront of all of our discussions here today, with a capacity that we began this going into this with less than 200 tests per day, now to over 2,000, and we'll be expanding again this week when the Panther machines come online to get us to 4,000. That's over a 20-fold increase in testing in less than 3 months. It's just one example of the incredible efforts that Team ND members have made in response to this pandemic to save lives and livelihoods. And on the backdrop of this great work that's been done, and as we transition into the next phase of the looking towards the future in terms of how we're going to be managing this pandemic, we'll be announcing a couple of changes that are going to take place relative to leadership at the North Dakota Department of Health. This emergency has revealed a historic opportunity for us to develop a more comprehensive, collaborative, and strategic approach to public health in North Dakota. And I think everybody understands that the scale, the urgency, and the complex unknown nature of this situation have underscored the need to rethink the current setup that was set up in terms of having a single officer try to manage the regulatory aspects of the state health department, the operational aspects of the state health department, and the strategic and forward-looking aspects of that. That would, I think, prove to be an impossible task for anyone, I said, given the scale and the urgency and the complexity of this. So we're taking steps to provide additional leadership positions to carry out both the day-to-day operations and make sure that we have a complete and fulfilling strategic direction for the state of North Dakota. So to accomplish these goals, today, announcing that we're creating a new position called the Chief Health Strategist. And this person is going to work to help set the course for how we're going to approach and redesign public health in North Dakota. I've appointed as the Chief Health Strategist for North Dakota, Dr. Josh Wynn. Josh Wynn is well known to everybody. He is currently, for the next few days, wrapping up a terrific tenure as the interim president of the University of North Dakota, and for close to the past decade has served as the VP of Health Sciences and the Dean of the University of North Dakota School of Medicine. He will begin on June 1. He'll report directly to me until the appointment expires next January. Dr. Wynn will continue to split his time between this temporary position as the Chief Health Strategist for the state of North Dakota and his longtime role again as the UND's Vice President for Health Affairs and Dean of the Med School. As the Chief Health Strategist, Dr. Wynn will work within the Department of Health to create a vision and strategy for developing world-class health enterprise in partnership with lots of folks, including the North Dakota University system, and that touches all 11 of our universities, because all of our schools are involved either in research or in workforce development, either for lab tech or pre-nursing or nursing or pre-med levels. There's programs going on across the state. We know we've got workforce challenges there. We'll continue to have healthcare workforce challenges. He'll be working to engage the local public health entities at the city and county level. He'll be working with the private sector partners. That includes medical providers and biotech and research companies. And he'll be working across the federal programs. There's lots of federal dollars that are coming this way through both CDC and Health and Human Services. He'll also be working with our tribal governments across the state of North Dakota, who we've already established some strong collaboration with as we fight this pandemic battle together as neighbors and as North Dakotans. In addition to this addition of this new position, I've also appointed Dr. Andrew Stahl to serve as the interim state health officer. He'll succeed State Health Officer Mylyn Tufte, who has shared her desire to return to the private sector and submitted her resignation earlier today. I want to take a deep moment of gratitude and thank Mylyn for her over 3 years of leadership for the Department of Health. We were pleased to have her join us. We recruited her. She came from the private sector, and during her tenure there, many important things have happened. She's been a terrific member of our cabinet, and lots of things happening. When she first came in, of course, the health department was thrust into a position of having to implement medical marijuana in the state that became via initiated measure. That was a historic point. Lots of other changes have gone on, but this time in the last 3 months, the incredible efforts by Mylyn and her team at the health department, together with the National Guard and other state agencies, all working together as a whole of government and as Team North Dakota to scale up their capacity, whether it's in contact tracing or testing. It's been nothing short heroic. And also the education, the answering the hotline calls, and on and on and on. I wanted to say on behalf of Lieutenant Governor Brent Sanford and myself, we're deeply grateful to Mylyn for her leadership and her service to the state of North Dakota. And of course, at both a personal and professional level, we wish her all the best and continue to support Mylyn and champion her as she goes forward. Mylyn has graciously agreed to stay on an advisory capacity for the next 3 weeks to ensure that we have a smooth transition and ensure a continuity of operations. Dr. Stahl, who will be taking on the role of interim state health officer, is no stranger to the state's COVID-19 response. As an officer in the North Dakota Army National Guard's Medical Corps since 2009 and a member of the Guard's COVID Task Force since March, since the very beginning of this, he's intimately familiar with our coronavirus response, and he's also been providing strategic medical analysis to help support it. Most recently, Dr. Stahl worked as an internal medicine physician at the VA Center in St. Cloud, but he's a Bismarck native, earned his bachelor degree at NDSU, and I should say Bismarck Century for those people in Bismarck that are keep track of which high school people went to, played hockey there at Bismarck Century. He earned his bachelor degree, summa cum laude graduate from NDSU, and went on from there to earn his medical degree at UND, and we're thrilled to have Dr. Stahl back in the state. Together, Dr. Wynn and Dr. Stahl have got broad expertise and experience across a wide swath of the medical fields, and we know that together we can work to create a blueprint for the development of the best public health system in the nation. In terms of Dr. Wynn, with his experience leading a university, running a medical school, it's going to be invaluable. And we've got a number of questions that we're going to engage, and we'll be engaging with legislators, legislative committees, the public, and again, the private sector and others, but questions that we want to ask ourselves as we enter into this process with both humility and with curiosity is, how do we better engage and utilize our university system and the research and medical capabilities of our research universities? How do we strategically deploy the federal funding that's been designated specifically for COVID response at the state and local level? How do we maximize the relationships between the state, the federal, the local, and tribal partners? How do we build out lab capacity for the future in a strategic way that supports both our citizens and the development of workforce and higher education? How do we best engage the private sector to help our growing and hopefully even more thriving biotech and pharmacy fields? And again, how do we develop a truly world-class public health in North Dakota, and how do we do that in a way that provides great service to our citizens, and we do that super efficiently with the citizens' tax dollars? As we've talked about a number of times, when you have a period of disruption, it creates an opportunity for innovation. When you have a period of great disruption like we're having now, it demands innovation. And I'm very much looking forward to working with Dr. Wynn and Dr. Stahl and the entire team, the Unified Command, Tammy Miller, General Dorman, and all the folks to see what we can do from this great disruption to create some great innovation. And we're looking forward to their leadership and their efforts to take our current strong public health system in North Dakota even to greater heights. Both of these individuals will assume their duties on June 1, and at future briefings, you'll have an opportunity to meet them, to greet them, either in person or on video. You'll see them at future events. But for right now, we'll just say welcome aboard. We look forward to your starting with us next week. And again, our tremendous gratitude to Mylyn Tufte for her leadership to guide us successfully through this point that we've reached. We're on the downward side of the curves in North Dakota. And again, thank you, Mylyn, and thank you everybody on her team for your incredible efforts to date. Next topic is K-12 Budget Executive Order. Today I signed Executive Order 2020-33. This came from a request from the Department of Public Instruction, and it was a very good request. This order suspends an ending fund balance rule for school districts that requires school districts must turn back to the general fund any amount exceeding their 45% of their budget. So if you had 44.99% or less of your annual budget in your ending balance, you could keep it. If it was above that, it got swept back to the state. As you know, through the CARES Act, separate from the dollars that the state received in sort of a broad bucket to fight this, there was federal funding that went directly and specifically to school districts. And as some of those received those dollars recently, and school was not in session, just the receipt of that would push them above that 45% limit. So turning off this turnback requirement would allow districts to use the CARE Fund Acts for the significant unanticipated costs associated with changes to the delivery of educational services because of the coronavirus pandemic, including next fall. And we've got Superintendent Baszler is here today, and she's going to talk a little bit more about this, I understand. So great to have you here. And again, thanks for championing this change, which we know will be a good one. Superintendent Baszler.
Thank you, Governor Burgum. It is strange as most of the executive orders have dealt with children or graduation celebrations or distance learning. And here we are, it seems a little bit more like a traditional end of the school year because as we are winding down the 1920 school year, we have budget issues to take care of. And so essentially what this order does is allows our school districts to plan for, along with their school boards, plan for and make some decisions about how they will use the budget money that they received, as Governor mentioned, from the CARES Act to lead into the next school year, 2021 school year. We didn't want to put our school districts, our school superintendents, and or our school boards in the really uncomfortable position of maintaining the compliance with the North Dakota Century Code and making sure that they were spending down their general fund, which is essentially the fund that is obligated for salaries and or programs and professional development. In addition to the CARES fund that have been deposited and distributed to a large number of our school districts already, there were certain things that were planned that our school districts had planned for this spring semester, specifically the last 9 weeks of the school year. Professional development opportunities, learning excursions that for their students that needed to be canceled. And so rather than having our school districts try to decide swiftly and quickly how they might be able to expend those funds, we are allowing them the opportunity to ensure that they're able to carry over those funds and do those intended professional development opportunities, those learning opportunities for our students. I would say that as we were thinking about this decision, worked with our legislators, both on the House and Senate side, to help to make sure that they were comfortable with this, that they understood that this was something that it was important, and the common goal, the common objective for all of us was to make sure that our school districts would have the funds that were necessary in order for them to do the intended purpose of educating our students, whether that be the last 9 weeks of this school year or as we delay that into next school year. So very grateful to the governor's office, to our legislators, and to our local school leaders who provided a lot of insight to us as we were working our way through this. So thank you very much, Governor.
Thank you, Superintendent, and again, this is a very common sense change that we're making because without this, there may have been an incentive for people to try to spend money, to spend below that 45% level before the end of the year, and we don't want to put any pressure on our local school districts to rush out and spend CARES Act dollars. We want them to be thoughtful about it, and if they may need some of those dollars as they think about getting our schools back opening again next fall. So again, thank you for this. And of course, I know Superintendent Baszler had briefed legislators on this, so thank you for all that outreach. I want to just give a shout out to say thanks to the legislators as well for supporting this relief during this year only for this ending balance to help with this unusual sort of bubble of federal dollars that came in. Okay, next up we want to talk about the behavioral health update. And as was previously announced, the Department of Human Services recently awarded a $2 million grant from the Federal Substance Abuse and Mental Health Services Administration, also known as SAMHSA, to support the state's behavioral health response to COVID-19. This emergency grant program focuses on meeting the needs of individuals with chronic mental illness or the disease of addiction. The program also supports individuals with acute behavioral health needs, including healthcare workers, first responders, or other frontline personnel, because we know the people that have been on the front line of this battle they're busy taking care of others, may also need to make sure they're taking care of their own mental health during this time frame. The pandemic impacts have been significant for many North Dakotans. This grant provides an opportunity to increase vital behavioral health services in the state. And today, the Behavioral Health Division made available informal requests for proposal, or RFPs, seeking 2 additional treatment providers, 1 additional mental health provider to develop and implement comprehensive plans of evidence-based mental and substance use disorder treatment services for individuals specifically impacted by the pandemic. The informal RFPs, those requests for proposals, they're available online at behavioralhealth.nd.gov. The deadline to respond to both these opportunities is June 10th, 2020 at 4 p.m. And by both, I mean the one is 2 addiction treatment providers and 1 mental health providers. We would encourage all behavioral health providers in North Dakota and all addiction treatment providers in North Dakota to review these funding opportunities, consider applying, because again, $2 million in grants available here in North Dakota through SAMHSA to help people who have been specifically impacted by the pandemic related to mental health or addiction. So don't miss out on that opportunity to try to expand our understanding and expand our services for those in need. Closing out, we've got a couple of sections left. One is a good news section. And of course, we know that technology is having a profound change on our lives, and it's proven to be an invaluable tool as we work together to fight the spread of COVID and work to get our economy rolling again. In fact, technology's played a critical role in much of our response, including contact tracing in terms of testing and all the new advances in testing. Technology's played a role in data-driven decision-making and modeling. It's played a role in digital service delivery for our citizens. It's provided a role in secure telework and in distance learning. And of course, all of those actions that involve technology and are interconnected are on a foundation of a need for cybersecurity to protect your data and the state's data from, again, not just criminals, but actually state-sponsored cyber attacks that continue every day against our state. As the technology, continues to change our lives, we need individuals who are skilled in computer science and cybersecurity to drive the implementation value up and the risks down. And for the second year in a row, North Dakota students have participated in a virtual online cybersecurity challenge run by a group called the SANS Institute, and it's called Girls Go Cyber Smart. More than 15,000 high school women from hundreds of schools nationwide participated for the second year in a row. Way to go, North Dakota. Highest participation per capita. 290 young women from 21 schools participated, and of those, 6 schools and 16 young women qualified for the final round of the competition last week. So congratulations to those 16 young contestants. Great job. Red River High School in Grand Forks, Williston High School in Williston and Century High School here in Bismarck were the top 3 placing schools in North Dakota. Williston, Red River were on top in terms of participation last year. Those engaging in computer science and cybersecurity classes, which are widely available through EduTech, are learning 21st century skills that are valuable in any career field that you go into. But if you wanted to go into cybersecurity specifically, just note to self, there is 0 unemployment. We talk about high unemployment in our nation. There is 0 unemployment in the cybersecurity field right now. Projected shortages of millions of jobs globally. And there's a variety of exciting career opportunities in computer science as a whole that afford high-paying, rewarding jobs. And of course, many of these can be accessed no longer needing a 4-year degree or a 6-year degree. You can gain skills in cybersecurity in even as short as a 16-week certificate program that certainly would increase your employability and offer high-paying opportunities. I want to say thank you to our educators, to our parents, to our administrators, our school boards, Superintendent Baszler and the team at DPI, and everyone involved in promoting this important activity and helping our students succeed and helping North Dakota lead with innovative education. And I want to say especially congratulations to the 290 young women from the 21 schools who participated in this year's Girls Go Cyber Smart. You can learn more at girlsgocybersmart.org. Way to go. In closing on the gratitude section, yesterday we recognized the life and the work of Rough Rider Award recipient Peggy Lee on the 100th anniversary of her birth. Today, we want to take a moment to recognize another group of people who play an important role in the mental health, an important role in the sort of the continuity and the creation of community that binds us all together, and those individuals that even as we're physically apart can help bring us together through their work. And that's why I want to take a moment to recognize the importance of arts and culture in our day-to-day lives and the incredible contributions of all the amazing artists, musicians, performers, and creators across all of the communities in North Dakota. Arts and culture are an important part of our social experience. They have been since the earliest histories of humankind. Even you go back to the earliest cave drawings, and we know that arts and culture, all the earliest societies in history on our planet have been bound together and have been moved forward, in part defined by how they placed importance on arts and culture. And today, while we practice physical distancing and protect one another, arts and culture are just as important as always, if not more, in helping us connect from one another. We've had some great things happening in our state during this. I want to give shout outs to musicians such as Jessie Veeder, sharing her talents through a virtual concert for our elders, to the many North Dakotans across the state who've been creating and crafting masks or other protective equipment, to our citizens and those on the front line, those people that, like right here in Bismarck, starting the We're in It Together Hearts program, very creative activity that went viral around the world. But anyway, lots of ways to continue to find ways to share beauty and help us connect. So today, we want to give a big North Dakota shout out to all our artists, musicians, performers, creators, writers, makers, craftsmen, cowboy poets. Whatever your talent, thanks for sharing it at whatever age, whether you're preschool, elementary school, high school, college, or throughout your life. If you're sharing your talents, thank you for sharing them when we need them the most. Closing on gratitude, a quote from Barry Neil Kaufman, a U.S. author, best-selling author of over a dozen books, says, "Gratitude is one of the sweet shortcuts to finding peace of mind and happiness inside. No matter what is going on outside of us, there is always something for which we could be grateful." I thought this was a great quote because there's a lot going on outside of us. Whether it's the pandemic, whether it's new business operating rules, whether it's new forms of education, new approaches to telehealth, new approaches to arts and culture. Everything we know has in some ways been transformed or turned upside down for a period of time. But one thing that can remain constant is peace of mind and happiness on the inside. And one way to find it is for us to recognize and be grateful for those things around us for which to be grateful. So again, thank you for exercising gratitude every day, and we're grateful for all of you, and we're certainly grateful for all of you tuning in as you do every day, and we're grateful for all the questions that come from the great media in North Dakota, and we are ready to stand for questions, and I would remind people that Superintendent Baszler is also here and available for questions. Okay, Dave?
And I would like Superintendent Baszler to come up and answer questions.
Way to go. That's why I called on you, Dave. Good job.
Yes.
Been in contact or been working with legislators.
Yes.
And this has been a contentious issue about ending fund balances. So how did you convince them to kind of back off on the idea that schools are carrying too much money over?
So essentially, I think it has been something that they have already been thinking about. This bill, or this expectation, was created in the 2017 legislative session, I believe, and it was a way to protect our taxpayer dollars, and generally that was the intent of it. Since that time, other precautions have been put in place in Century Code, and during this time, they understand that there was some need to expend more dollars because of distance learning, but there were certainly opportunities where they weren't expending those dollars, as I mentioned before. And so all of the legislators that I spoke with really understood we as North Dakotans embrace the idea of being pragmatic and thoughtful and reasonable as we plan. And so there wasn't anything in that ask that the legislators really disagreed with. There was also some conversation that I am now aware of, that the legislators are actually thinking about fixing some of that language in the 2021 session as we work together towards that. So I'm sure we'll have more conversations as we move through this and find a way that we can continue to protect our taxpayer dollars and make sure that our school districts have what they need without putting an extra burden on either the state taxpayer or the local property owners. Thank you.
Discussing the 2021 possible adjustment, would it be a removal of the 45% threshold or an adjustment of the 45%?
You know, I am not sure exactly what our legislators have specifically in mind. As we had these initial conversations about this executive order, we talked in real general terms about making sure that we found a way to correct that without putting an extra burden on our taxpayers and with our school districts. So I'm sure there will be a lot of conversation, as there is always regarding anything that is proposed as a legislative bill, with a lot of the stakeholders involved in making sure that we're having a very broad perspective, visiting with our property owners, visiting with our local school board leaders, our local school superintendents and business managers, as well as the legislators.
Are there any restrictions on the use of the 45% or above 45%?
There is not. So essentially the way that the mechanism is set up is if a school district did have an ending fund balance above the 35% threshold, there is a trigger that kicks in, and Adam Tesher, who was here earlier and could explain this better than I, but Adam Tesher would then essentially penalize them in future student foundation aid payments in the subsequent 2021 school year. Thank you.
Danny? This would be an online question.
Mike Smith, 660 KYZ in Williston. Can you give us an update on the Care19 Exposure app? When will it be released, and will we see a simultaneous release on Apple and Android, or will it be split?
I don't have an update today, but we'll add one for Friday on how we're coming with the Google Apple Bluetooth application. I do know the one part, it will be two apps. One will be Care19 Exposure and one Care19 Diary. So we do know that, but we'll get back to you on the release dates. Okay, Jeremy.
You had mentioned that the position of state health officer turned out to be kind of too much for one person, especially at this point. Did the stress of that position play a role in Mylan's resignation?
I don't think so. I mean, good question for Mylin, but she indicated in her letter that she's looking forward to returning to the private sector, and I think that she's been terrific through this whole thing. I mean, she's been tireless in her energy, and she's been doing one of the biggest jobs in the state and doing it with a lot of poise.
Was she asked to resign?
She resigned. Jacob?
Governor, in all fairness, you said that in times of disruption, innovation is needed, but in times of great disruption, it demands innovation. So and if I'm being honest, the creation of this new position at the same time that the resignation was received seems as though the timing is a little, not suspicious, but it seems as though that her resignation might have been requested.
Well, I think that Mylyn knows as well as anyone the challenges of trying to do essentially what I've described as 3 jobs. One is the regulatory role of being the state health officer. The other is being the administrative officer for running a department, which is the chief administrative officer, which is a hard thing to do, and then doing it at a time when all of your divisions are trying to increase rapidly in their scale and capability. And then you throw on top of that a whole new wave of strategic partnership opportunities that exist, whether it's with federal government, the CDC, higher education, tribal, on and on and on. I mean, there's at least 3 full-time jobs that the way this was designed pre-pandemic, one person was supposed to do. And I think that if you were, I say pick your superhero, Superman, Superwoman, Iron Man, pick your favorite. It would be an impossible task. So I think this is a recognition, and Mylyn, I think, completely supports this direction that in this step forward is that there's got to be multiple people stepping in to do this. The fact we've got 2 physicians stepping in, one is the chief health strategist, one is the interim health officer, and then with the capability of Tammy Miller to help on operations. These are 3 big-time experienced executives that are stepping in. So I think it's makes complete sense to me, and I think that Mylyn's regular communication with me through the whole period of this helped me understand exactly what we needed to do going forward in terms of adding capacity in terms of leadership there. I'm going to go to Lane, and then we'll go online. Lane online, I guess, is online or something like that, but we're...
Governor, we've talked a lot about innovation today, and in regards to state workers, I've noticed there's a lot more cars out in the parking lot. Was curious to see if any of that innovation was going to be used to potentially move some of those state workers home more often or even permanently.
I think the answer to that question is yes, and yes, yes, and yes. I mean, yes, we're as we move towards reopening the state offices next week, we're seeing some people back in the. Some more people coming back in the building. We've got a target of 50% occupancy next week. I know that the Continuity of Government Task Force, that's an internal team that's working on this, has really tried to specify what roles could be done as well or even better remotely than they might be in an office environment, and what are the areas where some physically being here, where it might be like customer facing, if there's still some things that we don't have, processes we don't have digitized, where we still got to do face-to-face work, some of those positions back in. But I think there's going to be a strategic look in every company in America, and it should be in every government agency. We should look about what things can we change permanently, because one of the best things we can do for citizens is to save them a trip, coming to the Capitol, whether it's for a record or a DMV renewal. I mean, if we can allow them to do that without having to spend their time and their gas and their effort to do that, that's a great way to save money for taxpayers. Who are we going back to? We're going online, and then we're going to swing back this way.
Gene Shemp, Hometown Radio Group in Minot and Bottineau. Did the malfunction at the state lab this past weekend play any part in Ms. Tufte's decision to resign?
No. None whatsoever. The lab's done a fantastic job. Jeremy?
Did you or anybody in your office personally ask Mylyn to resign?
Mylyn first started talking earlier this year about wanting to serve through the end of our term. I think everyone knows when we came into office, we revived a tradition of asking all cabinet leaders to resign after we were elected. if Brent and I are elected, re-elected this fall, if we're fortunate enough to serve the people of North Dakota again, we would have that conversation with all of our cabinet leaders again to see if people want to re-up. Pandemic or not, being a cabinet leader for the Burgum-Sanford administration requires a lot of dedication. I think they know exactly how hard everybody in our office is working in the governor's office, and there's an expectation that people work equally hard. Mylyn was one of those people who worked equally hard. She was a tireless worker. But I would say in being at the epicenter of the pandemic, Mylyn had made a commitment when she came 3 and some years ago, 3 years and 3 months ago, that she would work through the end of our term. I feel like she fulfilled her commitment, because working in that role is like dog years. I mean, she's like, she's probably worked enough hours for an entire another year just through this pandemic. So completely understandable to me that she might want to make a move back to the private sector, and I would guess, she, like a lot of people, took a pay cut to come from the private sector to go here, and I'm guessing that her market value is going to probably go way up when she goes back out because of the work that she did here and because of the experiences that she gained. There'll be a lot of demand for people with the kind of experiences that she has.
To be clear, she was not asked to resign?
This is a plan that Mylyn had talked about, and then we just talked about when would be a good timing, and the good timing for this, as she felt right now. Her resignation letter, I'm sure, is available, but you can see in there that she talks, I think, in shorter than maybe others might, in terms of the great accomplishments of the department under her leadership, and that this is probably a good time as we're kind of entering a new phase here going forward, and particularly if we've got to try to build a plan over the next 6 months of how we think we want to have this setup be for the next the next legislature and the next going forward. I want to say again, I think super thoughtful of her. She's a consummate professional, and I think the timing of her resignation is, she understands that this is helpful for us in terms of where we're going, in terms of how we're going forward, versus saying, hey, I'll serve through the end of November, and then we got 1 month to get ready for the next legislative session and find a new leader. Long lead times to build new leadership teams are one of the greatest gifts that leaders can give to their successors, and I always appreciate people that give long lead times, and this was perfect, I think, in terms of timing. And so again, I just want to thank Mylyn for that professionalism and this opportunity for us to put together an interim team while we look to build a permanent one in a time frame, say by next January. Okay, Dave?
Josh Wynn, then, is it true that he's going to keep both jobs in for the time being?
Yes, Josh will do exactly as he did when he was running the university. And when we talked about this, and again, you'll see in the press release that's just out, part of this discussion included a conversation with Chancellor Hagerat. I've had multiple good conversations with incoming President Andy Armacost, who starts on June 1, and very excited about President Armacost coming here from the Air Force Academy. He's going to be a great hire, a great addition to our other 10 presidents that we have across the state. And with their full support, then again, because Dr. Wynn has been doing half-time VP of Health Services and Med School.
This is a KX News special report.
Others are going to want to join in this planning effort with him to help us. I think we really have an opportunity. I get very excited about an opportunity with both of these leaders plus Tammy Miller to really solve a short-term scaling challenges, because we got all the scaling we've done. As you know, we got to keep scaling again. but while we're doing that, it's very hard when you're in the middle of an operational battle to actually do strategic planning. So setting up a separate role to focus on the long term, particularly when we've got this much amount of federal dollars that need to be directed by December 30th, that'll be one of the big things that Dr. Wynn will be taking a look at is how do we most effectively and efficiently apply all the dollars that are already have been allocated to our state, but there may be more coming towards specifically that need to be spent towards public health. How do we do that in a smart way? Okay, I'm going to go Jacob, then I'm going to go online.
In reference to Mylan Tufte, you said that it was this move was super thoughtful of her, and she understands how helpful this is to us. What role did she play in forming this new leadership?
Well, I think throughout this, from the very beginning of this, you go back to the beginning of March, and Mylan was, before Tammy Miller had joined us, Mylan was one of the co-leads of the Unified Command, so she's been right at the forefront along with General Dorman. And when Tammy came and Mylan went into essentially full-time state health officer role, as opposed to state health officer and Unified Command, that's when from the regular communications we're having with her, that's like, this is just, this isn't one job anymore. I mean, it might have suggested that in the history books or even in the code, that one person could do all these things, but this is under the emergency situation we're in right now, this is a job that requires a division and clarity about mission of what those different roles are in terms of state health officer regulatory, operational effectiveness, and strategic planning. And now we've got 3 people effectively lined up where before we had 1. And I think Mylan probably more than anybody on the planet understands that's needed, because it was just it's an overwhelming amount of things for one person. You can't, not 24 hours a day doesn't get you through all those things. And believe me, she was working as hard as anybody in the state during this whole time. Okay, online?
We don't have any right now.
Okay, that's shocking. Thank you. Connection down. Online, calling all online media. No, we got plenty of hands up here. Jeremy? Back to you. And listen, I've pointed out before what Lane is wearing. I do think it's important for people to know that you are wearing a bison hat. So thank you for that.
I wanted to ask about Dr. Stahl. You'd mentioned that he's returning from St. Cloud at this point. Is he, I'm just kind of unclear from the press release that we're reading. He's returning at this point right now, but he is still a member of the North Dakota National Guard.
Yes, he is. And he was in the process of moving back here with his family. He'd received an offer from Sanford. He's delaying. Sanford's been great. They've held the offer open to him till January 1 to give him an opportunity. So they he was a member of the North Dakota National Guard while he was working at the VA hospital in St. Cloud. Originally from Bismarck, as I said, moving back here with his family. Sanford had offered him a job. The pandemic came up. He was mobilized full-time by the Guard, and so he's been working under the Unified Command since March here. And again, he's got a combat background. He's been deployed overseas. He's coming up on 20 years of service in the military and has had a great medical career besides. And so right now, we've got so many Guard members that are 300 Guard members still deployed. This is a great solution for us from an interim standpoint to have someone who understands healthcare and understands the military deployment to come in and help us in that state health officer role.
Sort of a follow-up to that, I understand the interim title, so I won't ask about that, but for Dr. Wynn, do you expect that to be a position that he's holding for a long time, or is that just for the time being?
So now through January 31st, so 8-month assignment. And we want to time box it. He's got an important work to do to get back to his very big job up there in the University of North Dakota Medical School, fantastic institution. Budget-wise is the third largest university in the state. He was running that and running the University of North Dakota at the same time. He's a leader with a lot of capacity, a lot of vision, a lot of capability, and he's been a dedicated servant to the state in terms of his giving of his time to be the interim president during this past year, and for us to hit him with a request when he probably thought, hey, he was going to go back to one job and say, no, we need for another 8 months for you to do 2 jobs. I'm very grateful for him to stepping up and doing this. He was really the ideal candidate for this role because he's currently a state employee. He understands state government. He has also served in the military. He understands the capacity and capability that we need. He's got connections nationwide in terms of what best practices would be, and there is likely no person better than we could get. We're very fortunate as a state to have that resource here, and I think that it's going to lead to some great outcomes for all parties, state, local, higher ed, private sector, broad thinking, and I'm very excited about the opportunity to work with them on the strategic planning for all of health. Chris Jones will be involved in those conversations as well, because there's, probably there's an opportunity for us to think about, how do we improve the delivery of services across all areas of health in terms of how we divide up those responsibilities and how we execute against them. So excited about looking for synergies and opportunities going forward. Could be a historic opportunity for us that we don't want to miss in terms of changing the direction where we can, probably been overused, but I would say for Josh Wynn, I've said this is a win-win-win for North Dakota, if we can do that, get him here. Okay. The groaning continues in the room. Okay, now we have one online, and then we're wrapping up. I'm getting the signal. I'm getting the last Sioux signal from Mike over there with the, I think we got to get on another call. Okay, Danny, online?
Jean Shemp, Hometown Radio Group. Do you have an update on the 150,000 antibody tests the state ordered last month, and do you still plan on offering that antibody testing across North Dakota?
Good question, Gene. I don't have an update today. We'll add that to our list for Friday. Thanks for that reminder. Okay, with that, we're going to say thank you. And again, thanks everybody for tuning in. Thanks for being North Dakota Smart. Thanks for all the great work you're doing to help save lives and livelihoods. And to our media, thanks for all your great questions. And to Mylin, thank you for your incredible service, and looking forward to the new team starting on Monday as we work to build a great future for public health in North Dakota. Thanks everybody.